So tour of the hospital, labor and delivery, postpartum, and nursery. So you're going to come to the Women's Center, not the ER. So you're going to come to the Women's Center where we're located, except labor and delivery is on the 4th floor. You're not going to come to the doctor's office when for labor or for if your water's broken, unless we've instructed you to come there first to see. But if we're sending you to labor and delivery, you're going to go to the Women's Center. You're going to get on the elevator, go to level 4, so the 4th floor, and then labor and delivery is on that unit when you get off. So no other floor. You're going to go to the 4th floor. If you come in middle of the night, those doors to the Women's Center are usually locked. So you'll push the doorbell on the right-hand side wall. You can't miss it. You'll push that button. It'll alert them that somebody, and there's a camera system there, so it'll alert them that somebody's there to check in. They may or may not ask you. If they see a pregnant mom, they probably will open the doors. If it's just partner, they may ask. Excuse me. And then once you come in, again, you'll take the elevators up to level 4. And then when you get off the elevators, you can only go one direction to the check-in desk of labor and delivery, which is going to be for triage. So we're going to start in triage, which there's 8 triage rooms. They're going to check you out to see what's going on. Are we going to keep you to have a baby, or are we able to send you home, depending on situation? And then if we're keeping you, we will move you to a labor and delivery room. I don't have pictures of the triage rooms because the times I've gone up there to get them, they've been full. So I've never caught it at a time I could get one, but I have pictures for you to see in a little video of the labor and delivery room for you guys. And then of course, postpartum. There are 32 labor and delivery rooms. They're all private. You will not share those. There's 8 triage rooms. We had 4 down in the 2nd floor when that's where we were. There's 4 OR rooms and 1 main OR recovery. There's 61 plus postpartum rooms. They, I think, are either finished or near finished with converting the 2nd floor, old labor and delivery, into postpartum rooms and antepartum or preterm labor rooms. So, and then the newborn nursery, there's 1, and then there's 1 neonatal unit. Those are in the main hospital, and so are the main postpartum rooms are in the main hospital, connected by breezeway or skyway. So I know it's a little silly, but labor and delivery is the 4th floor, antepartum and is the 3rd floor, and then postpartum, just extra rooms because there was 29 labor and delivery rooms initially on the 2nd floor. So now we've extra postpartum rooms and then some antepartum rooms. And then of course our office. So you're going to go to the 4th floor here. This is that check-in station of labor and delivery. This is where you're going to give them your name, your date of birth. They should already know to expect you, whether you're being induced, coming in for a scheduled C-section, or you called during office or after hours and we sent you in. They should know that you are going to be coming in and have your information, and just to verify it with you. Always bring your ID and your insurance card, even if you're pre-registered, just in case if there's any questions there. This is the, no, give me one second. This is the doors leading into triage, those 8 rooms that we initially will start off in, and then move to a labor and delivery room if you're staying to have your baby or babies. These are on the, so these double doors, go back, are on one side, the back side of that nurse's station that you're going to come up to and get admitted. These are on the front side, right here, these double doors, and they're both locked. So you have to, be let in, basically. This is the hallway down labor and delivery. On one side, it's kind of like a perimeter, so it goes on 4 sides. This is a labor and delivery room in our North Austin, one of our new rooms. So here you see the monitoring at the bedside that can be done. The labor and delivery bed, which is actually pretty comfortable. Right here. So very, very comfortable bed there. The foot of the bed can break down, taken off when it's time for delivery. We usually will take the foot of the bed off. You see stirrups underneath. You guys can control your up and down positioning You will have a call light that you can ask for the nurse there. And then, of course, you can control the TV in here. So again, it's a little bit closer picture of the bed there. Here's the couch. So these actually are a little bit longer now, but these are couches where the partners can stay. We have them also in postpartum, so you can stay the night. We actually can pull them out, and then we provide the linen for you to stay overnight. And then this is the rocking chair. So every room in postpartum and labor and delivery has a couch and has a rocking chair. Here you see the call light right here, and of course the phone. However, you can use your cell phones, which is what most patients do. Here's a little bit better picture of the couch right here. Got the TV here with just your basic cable. Here's the warmer. So eventually we're going to want to get the length and weight and temperature of your baby. So that's where this will come into being, but you get to do your bonding first. So, and then up a little bit more close for you guys. Here's a picture of the birthing ball and the peanut pillow right here. There's a sink on the outside, plus there is a sink on the inside in the bath with the bathroom as well. So here is the sink. Here is the toilet. And here's the walk-in shower. You walk in, got a bench here, and then of course the shower head. So here's the surgery suite right here. We can't go in. They won't let us go in and take any pictures or video, but this is the surgery suite, which was where all the ORs, the 4 ORs and 1 OR recovery are located back here. Here's the video of the actual labor and delivery room, kind of walking you through it into the bathroom. So that's from coming in to getting to see everything in, plus the bathroom right there. Excuse me. This is the squatting stool right here. This would lean down so you can kind of kneel on it and lean into it. These go fold inward so you can rest your arms on it as well. So that's the labor and delivery unit, the new unit. And it basically kind of forms a perimeter, just like when it was on the second floor as well, with 32 rooms there. Postpartum is going to be on the second floor of the main hospital, and then of course taking over where old labor and delivery used to be in the women's center, which is our going to be postpartum and antepartum. This is actually where a majority of your stay is done. So in the main hospital, because it's older, those rooms are going to be smaller. The rooms in the women's center that are postpartum are going to be a little bit bigger because they're converted from labor and delivery to postpartum. But this is where a majority of your stay is done. You can have 2 visitors also at a time between 5 in the morning and 8 at night in postpartum, and then only 1 overnight guest. And they're not as picky about the 2 visitors, because I've been in rooms before to go see one of our patients, and I walk in and you got 2 sets of grandparents and myself and another nurse from the office. So they're a little bit lenient on that, but ideally, roughly 2 visitors at a time between 5 in the morning and 8 at night, 1 overnight guest. You do have to sign in as far as any visitors have to always sign in at the nurse's station and sign out. So you'll get a sticker that you've signed in, and then when you're leaving, you have to sign out. You come back the next day, you have to sign in. So, which I love. And the unit is locked down. So you have to buzz to even get in, which is also really helpful. Let's see. Again, you order food from the cafeteria. You can have it brought in. You can have it delivered. You can have someone bring it in for you. I know with my best friend, when she delivered, I was the runner to go to Wendy's, ideally Chick-fil-A, but they were closed. So again, you can have someone bring you food. You can have it delivered. Just ask the nurses at the nurses station what's kind of the best places around there that deliver. Excuse me. This is the nursery. So this is that newborn nursery. This is the transition side, which means these are our newer babies. They might be getting their baths here. They might have a delay in their bath, which is fine. You know, sometimes we'll do the baths at 2 hours of age. Some parents want it at 24 hours, and some parents want to go home and do the first bath at home, all of which is normal and fine to do. You guys are allowed in the nursery because you'll have the baby band that matches your baby, but only you and your partner and no one else. Now, circumcisions are done in a room just outside of the nursery. You're still allowed to go, but again, only the two of you. I don't recommend it. I've assisted with many over the years when I worked in labor and delivery and even before as a nursing assistant, but you can. You know, he's your son. The OB is who does the circumcision, so not the pediatrician. Your OB will do it before you go home. So again, you're allowed to go if you would like to go watch. Now, on the other side, on the other end of this nursery, same nursery, one end is transition, the other is what we call the holding nursery. These are babies that are coming in there. Parents want to maybe take a nap, and babies will go in there to be watched by the nursing staff and then brought back to you. We do change diapers, and we will occasionally feed babies with bottles if that's what you want. But if you're wanting to breastfeed, then we'll bring baby back to you, even if it's a little sooner than we thought that they've woken up. So we won't give them automatically a bottle unless you've instructed us otherwise. So just let us know that. And so this is a postpartum room. So you can already tell it's a little bit smaller. The bed is actually comfortable. In this case, the sink is on the outside and the bathroom is right behind it. Again, a private, but you're going to have the toilet and then a smaller walk-in shower in the bathroom that you're going to see. Here's the couch. One end pulls out for partners to stay after hours, which plan on staying because moms don't want to be by themselves. And with our C-section moms, actually, you can't have baby in the room with just mom until you've gotten up out of the bed at least 2 or 3 times and are finally able to get out of bed on your own. Then if somebody needs to leave and leave you with baby, that's fine. Up until that point, baby would have to go to the nursery because they cannot stay in a room just with mom. So rocking chairs here. You're going to fill out birth certificate information, which is a lengthy thing to fill out. So I would start on that when you get to postpartum. That's when they first hand it to you. Go ahead and start on that right away because it just takes a while to complete that. Of course, TV. Here's the bathroom. So you see kind of a smaller walk-in shower here with the toilet here. And then on the other side of this wall is going to be that sink that we just saw in there. As far as security, we have those ID bracelets that we talked about earlier. Baby gets 2, one on their wrist, one on their ankle. They match the one for mom and the one for partner. They will also get a Hugs and Kisses magnetic bracelet on their opposite ankle. So if you start to mess with it and try to take it off, or if you get too close to a main doorway into the hospital, it's going to sound an alarm. And everybody knows where they're supposed to be. Elevators shut down. Somebody manned at every stairwell to see what's going on. So they definitely prioritize. They also practice. They make sure that the system works. They make sure everybody knows what their responsibilities are. So it's not that they just threw that up and then hope it works. They always are practicing it. And then we finally will take that magnetic bracelet off when we're literally wheeling mom out to be discharged out. Also remember that baby is not going to have to leave the unit. Okay, they're not going to go to the ground floor to get an x-ray or sonogram. Babies will stay on the unit. Everything is portable there. So you also want to look for pink badges. So as far as the women's center, so labor and delivery nurses and staff, postpartum, nursery, pediatrician, OB, they will all have pink badges. And so that lets you know that they are affiliated with the women's center or the women's delivery postpartum nursery. So definitely looking for the pink badges. Hugs and kisses system there. When you show up, so when you get to the hospital, you're going to go again, kind of recap. You're going to go through to the Women's Center. You can park in our lot that you normally park in. If you're not valet parking that you normally park in for your visits, you can absolutely park there. Perfectly fine. And then you'll go into the Women's Center. You'll take the elevator up to level 4. You'll check in at that nurse's station and wait in the waiting area till you're pulled back to their triage. From labor and delivery, once you're admitted and you deliver, then we're going to move you to postpartum room back on the 2nd floor. Either in the main hospital or now in the Women's Center when that's fully open. Move you back to the 2nd floor to do your postpartum stay. When you're discharged home, you're actually going to be discharged out back down to, for the main hospital, you're going to go through the east entrance, so down to the ground floor, and then we're going to wheel you out through the east entrance, which basically is next to the women's center entrance, where the valet parking is that east entrance. So that little roundabout, you can, for partners, you can pull your vehicle up there, go get everything that you've loaded on a cart and bring it down, so you don't have to navigate the parking lot. Go bring it down, get it loaded, and then go back up, and then you're able to walk down with mom being wheeled down by the nurse there. And then she doesn't have to navigate the long parking lot to get to the vehicle. So, so we will take you through that east entrance, which is the ground floor there. You do have to bring your car seat, infant carrier up to postpartum. So the nursing staff there is going to make sure you know how to buckle baby in appropriately. So they can definitely show you that. What they can't do is they can't inspect the car seat once it's in the vehicle as far as the base of it. But they can definitely, make sure that you know how to buckle your baby in appropriately and safely. All right. And actually this, I want to say that this pricing for CBR is still, I believe, going on. Sherry Brown, she has been our rep for a while. So this is how you definitely can get a hold of her if you've got any questions regarding cost, regarding just questions about cord blood itself. She can definitely answer those questions for you guys. You guys are officially done. We're going to kind of walk through a few more things like birth plan and list and stuff. And then you guys are going to get out actually early. So sample birth plan. And if you don't have a birth plan, that's okay. You do not need to make a birth plan. So there's again, like I mentioned earlier, very little that you're going to ask or request that we can't somehow accommodate for you. But if you wanted to, you would put, your name, partner's name, your OB, pediatrician. So you do have to have a pediatrician picked out when you go home from the hospital. Not necessarily when you come in, but definitely when you go home from the hospital. So, and don't pick a pediatrician because they round at the hospital. Most private pediatricians are not rounding at the hospital. So they're letting the on-site hospital pediatricians round on babies every day they're in the hospital and then discharge them home. And then all that paperwork gets sent over to your pediatrician for your first visit, which is usually within a day to a couple of days after discharge. Also, if you had to go home on a weekend and you need to be seen on a Monday, that's fine. Just call the pediatrician office first thing on a Monday morning, let them know, and they're always going to have those appointments available. But usually you're going to be seen either the day after you go home or within a couple of days of going home to follow up with your pediatrician. So, and then, obviously hospital here, labor and delivery. So you're going to labor and deliver in a room, recover, and then you're going to move to a postpartum room. IV, so an IV is going to be placed regardless. It just may not have to have fluids connected. Fetal monitoring, where we were monitoring baby's heart rate, your pattern on your bellies, moms, continuous or intermittent. Most of that has to do with your overall labor plans as far as natural versus medicated, and your situation. So, you might put intermittent on here and we may have to do continuous, possibly. Anesthesia. This is the one I've always had patients go, well, if I put one and I change my mind, that's okay. What you're putting on here is kind of what you're thinking that right then, always subject to change and never a binding contract. So you can always change it as needed. Do you want the mirror to be available? Obviously, episiotomy only if necessary. Umbilical cord, are you going to have partners? Are you going to cut the cord? Do you want your doctor to cut the cord? If you're doing cord blood collection, let us know which cord blood bank. Do you want baby presented to you immediately with skin to skin, or do you want them to be swaddled and then present it to you? And then as far as feedings, are you going to formula feed, or do you want to be able to breastfeed right away? Hospital stay, I mean, obviously as short as possible, especially since COVID. I feel like couples want to stay a little bit shorter. You're not going to get to go home any sooner than 24 hours postpartum from a vaginal delivery. Usually most couples go home in 36 to 48, and C-sections in 2 to 3 days. So 48 to 72 hours. Insurance will pay up to 96 for a C-section. It's a rooming in facility. We assume you want baby rooming in with you, but if you want baby to go to the nursery while you're staying in the hospital, just let your nurse know, and then they can take baby to the nursery for you. Vaccination. So when your baby is born, they're going to get a shot of vitamin K because their bodies are not going to be able to clot very easily. They were relying on mom, and now they're not. Vitamin K is found in dark green leafy vegetables, of which they're not going to be getting through breast milk very easily, and definitely not through formula. So vitamin K, because they've gone through some head trauma coming out vaginally, if they're going to have a circumcision. So definitely we do the vitamin K shot. We do erythromycin ointment on the eyes just to prevent any kind of eye infection if they were exposed to any bacteria. So it's kind of a little goopiness in their eyes at first. And we can do that after you've had time to bond. So we're not going to need to do that right away. And then we offer the first vaccination called hepatitis B. It's a series of 3. The first one is offered in the hospital and recommended by your pediatrician. The other 2 are done in the office. So, and then letting us know with a little boy if you're going to have your son circumcised or not. So again, erythromycin ointment in the eye, vitamin K shot. We also will do a bilirubin test where we monitor across their forehead to check for, all babies are going to have a little form of jaundice just because they're not feeding very well, but we will definitely be checking them every day with that. Occasionally we may have to do a blood draw for that, but rarely. We also will do a congenital heart disease screening test where we check their pulses from their hand to their foot, make sure that they are the same. There we will also do a hearing screen, and that's done before you go home. Some babies don't pass the first time, and we'll always repeat it before you go home a second time. If they don't pass that one, then your pediatrician will set up an outpatient one. So it's common to not pass that first one, especially for C-section babies, because there can still be fluid in their canal that, again, wasn't squeezed out during the birthing process. So, and then we will do a metabolic screening test, which is a blood test. Before you go home, we will collect it, and then they will collect it again in your doctor's office about 2 weeks later. And it just checks for over 28 metabolic disease processes, because if baby is positive, and we know early enough, we can do things starting then that will prevent any kind of mental retardation later on, and it works very well. I mean, something like protein allergies, milk allergies, hypothyroidism, cerebral palsy. So lots of things that we check for. We do the first one again in the hospital. The reason we repeat it in your pediatrician's office 2 weeks later is because they're not feeding very well yet in the hospital. So there might be some protein allergies that we're just not going to pick up on yet that we're repeating in 2 weeks. So again, that test is done before you go home, usually at 36 hours of age, and then repeat it in your pediatrician office. And then we'll see you, if you've had a C-section, we will see you at 2 to 3 weeks postpartum with your physician. Vaginal delivery at 4 to 6 weeks postpartum. What to pack? I love lists. My kids make fun of me because they're like, you live on lists too much. But I like to check mark things off as I've packed them. So this is what to pack for the hospital for mom. For baby, this page, and then I have a follow-up page here. But for baby, you just need an outfit to go home in. you need a car seat, and ideally an appointment with your pediatrician. However, you might have to make that call the next day if you're going home on a weekend, and that's okay. But we provide everything else. You could bring 10 outfits and change your baby that many times, or just bring the one outfit going home with and use ours, our little snap front t-shirts. We provide the diapers, which are Huggies. We provide the wipes. We provide the swaddling blankets while you're here. Any formula, if you're going to use that. So we provide everything but the outfit to go home and in the car seat for them. Best breast pumps, because we can help you guys with ordering a breast pump while you're pregnant. And insurances should cover most, if not all, of those. So now the top two that insurances will not fully cover because those are the wearable ones. They're the $500 plus pumps. But Medela and down, majority of insurance companies will cover all for the pumps, and then you might have to pay a little extra for any accessories to go with it. Recommended books in case you want to read some more books. These are definitely some good books out there. Information on what to expect at the hospital, Q&A session. They offer this in person and virtually. So you could go to this website here to look that up to get the dates. My understanding is it's no charge. The one that's in person is done in the auditorium in the main hospital on the second floor. They do not do any in-person tours. Just so it also would be a virtual tour, but they can offer a Q&A session if you would like to go. You can also go to St. David's, so STDA. Basically, you can go here. If you go to stdavids.com/calendar, that's really all you need to put in, and you'll be able to find it for that. And this is relatively new. I think they offer it once a month on a Tuesday, if I'm not mistaken. And then remember that babies can make love stronger, days shorter, nights longer, home happier, the past forgotten, future worth living for.